Welcome back to our nursing care series. In today's episode, we will be discussing the nursing care plan for stomatitis. Stomatitis refers to the inflammation of the oral mucosa, which can be caused by various factors such as infections, trauma, or systemic diseases. As nurses, it is crucial for us to provide comprehensive care to patients with stomatitis to alleviate their symptoms and promote healing. So let's dive right into the care plan. Before we begin implementing a care plan, a thorough assessment of the patient is essential. This includes gathering information about the patient's medical history, conducting a physical examination of the oral cavity, and assessing their overall health status. Assess the patient's medical history, including any underlying conditions or ongoing treatments that may contribute to stomatitis. Evaluate the severity of the symptoms, including the location and size of oral ulcerations. Assess the patient's pain level using a pain scale to guide appropriate pain management interventions. Assess the patient's diet and oral hygiene practices, including toothbrushing and flossing. Also, assess if the patient's diet is high in acidic or spicy foods. Assessment of the patient's medication regimen is also very important as it helps us to determine if any medications are contributing to stomatitis. During the assessment, you should focus on identifying the underlying cause of stomatitis, such as viral or fungal infections, poor oral hygiene, or adverse drug reactions. It is also important to assess the patient's pain level, nutritional status, and any associated symptoms like fever or difficulty swallowing. Once the assessment is complete, we can move on to the next step, nursing diagnosis. Based on the assessment findings, the nurse can establish appropriate nursing diagnosis for the patient with stomatitis. Some common nursing diagnoses for stomatitis may include 1. Acute pain related to oral lesions and inflammation. 2. Impaired oral mucous membrane related to inflammation and infection. 3. Imbalanced nutrition. Less than body requirements related to difficulty eating or swallowing. 4. Risk for infection related to compromised oral mucosa. 5. Deficient knowledge regarding self-care measures for stomatitis. The patient's medication regimen is also very important as it helps us to determine if any medications are contributing to stomatitis. Once the nursing diagnoses are identified, we can proceed to develop a care plan with specific goals and interventions. The care plan should be individualized to meet the patient's specific needs and address their identified nursing diagnoses. Let's discuss some key components of a care plan for stomatitis. Goal 1 is to promote healing and alleviate pain. Provide appropriate pain relief measures, such as topical anesthetics or analgesics as prescribed. Encourage the patient to maintain good oral hygiene by gentle brushing with a soft toothbrush and rinsing with a mild saline solution or prescribed mouthwash. Advise the patient to avoid spicy or acidic foods that may irritate the oral mucosa. Encourage adequate fluid intake to prevent dehydration and maintain oral health. Goal 2 is to ensure adequate nutrition. Collaborate with the dietitian to develop a soft or liquid diet plan based on the patient's preferences and nutritional requirements. Offer nutritional supplements or fortified drinks if necessary. Educate the patient on proper chewing techniques for alternative methods of eating if swallowing is difficult. Monitor the patient's weight and nutritional intake regularly. Goal number 3 is to prevent infections. Promote good hand hygiene for both the patient and caregivers. Educate the patient on the importance of regular oral care and provide guidance on proper toothbrushing techniques. Monitor the patient for signs of infection, such as increased redness, swelling, or discharge from the oral lesions. Administer prescribed antimicrobial agents as ordered. Goal number 4 is to provide education and support to the patient. Educate the patient about the underlying cause of stomatitis and how to prevent its recurrence. Demonstrate self-care measures, including oral hygiene techniques and medication administration, if applicable. Provide emotional support and reassurance to the patient, as stomatitis can be painful and affect their quality of life. Encourage the patient to ask questions and address any concerns they may have. After implementing the care plan, it is crucial to evaluate its effectiveness and make necessary adjustments. Regular reassessment of the patient's oral cavity, pain level, nutritional status, and overall well-being will help determine the progress made. If the goals are met, the nurse can revise the care plan accordingly. However, if the desired outcomes are not achieved, it may be necessary to collaborate with the healthcare team to explore alternative interventions or consider further diagnostic tests. Providing optimal nursing care for patients with stomatitis requires a comprehensive and individualized approach. By addressing the underlying cause, alleviating pain, promoting healing, and educating the patient, we can support their recovery and improve their quality of life. That's all for today's nursing care plan for stomatitis. We hope you found this episode informative and helpful. Remember, as nurses, we play a vital role in the holistic care of our patients. Thank you for joining us, and we'll see you next time.